Yes.
Wamama hoi.
Hoi.
Kwa hivyo leo tumekongamana hapa, tumesema heshimu
uzazi.
Heshimu
uzazi.
Heshimu
uzazi.
Na tumesema kwa Kiingereza stop obstetric violence, stop OBV, stop
OBV,
stop
OBV,
stop
OBV.
Asanteni sana. Press, I am glad that we are here today as we celebrate the 16 days of activism in Kenya, as we press for the rights of women of Kenya, as we mourn the many women who have died, either through extreme violations of their rights as women or through childbirth. We are here as women leaders of Kenya from various counties represented here, backed by members of parliament and members of county assembly from various counties, to give our collective voice on matters to do with respectful women childbirth process, and also to reduce the occurrence of the many women who are dying in Kenya in the hands of our governance systems in this country. As a member of parliament, I'm live to the situation of the country where women have been butchered, women have been maimed, women have been made IDPs in their own homes. They have been displaced from their communities. They have been denied access to their rightful share of properties, and many other violations women of Kenya have been going through. As a member of parliament, I stand to project the voice of the many oppressed women of this country. Today, as we mark the 16 days of gender activism in Kenya, we congregated here at the Kenya Women and Children's Wellness Center in Roysambo, Nairobi County, flagged by the local leaders from the area MCA, the area member of parliament, the area women representative, Her Excellency Esther Passaris, who has just left, and many other leaders from this county and women leaders of this county and other counties from Meru, Isiolo, Kirinyaga, Embu, Murang'a, Bugoma, Busia, Homa Bay, and even Turkana. We are here as the women of Kenya. Irrespective of our political affiliations, we are here to speak for one constituency called the constituency of the women of Kenya. Yes. We want to note with a lot of concern the numbers of women who are being killed in this country under what we call femicide. We also want to note the many sexual assault cases that have been reported in this country unresolved. We also want to note the many incidences of domestic violence where women have been maimed, cut their fingers and limbs, violated sexually and psychologically and emotionally. This is a matter that is so aggressively and progressively increasing to the extent that we cannot keep quiet anymore. No. So today we came here to talk about one aspect of violation called obstetric violence. Violence melted on women during childbirth, after childbirth, and even continuously, even when women are carrying babies as what we call pregnancy. This is violence that is being witnessed live on TV cameras, live on our social media streams, live even in the hospital scenarios. We've lost countless women when giving birth. I am quick to note that in Kenya, where other countries like Uganda and Rwanda are recording lower deaths during maternal delivery, that is maternal deaths, when they are registering lower neonatal deaths, Kenya's numbers are increasing. And there are many reasons why these numbers are increasing. We have doctors here like Dr. Eli and many other doctors with us, and they can confirm that there are serious issues that we need to address. One, mothers have continuously lost their babies during birth. Watoto wanaibiwa. We do not know whether there is child trafficking circles in this country, and we want to flag out this issue. The other day we saw a mother crying in Mama Lucy Kibaki. The other day we saw a woman crying in Naivasha District Hospital, where you deliver twins and then you lose one baby to nobody because there is no accountability. Two, we have had many mothers sharing beds in our hospitals A very good scenario is when we saw Mama Lucy Kibaki Hospital. Women are sharing beds, something that is completely out of place in terms of the systems that are supposed to be used for access to maternal health care. Referring to the Kenyan Constitution, Article 43 allows every other woman in Kenya to access health without coercion, and no law in this country justifies detention of women in hospital after childbirth.
Yes.
We have so many women in this country who are bringing up their infants in hospitals because they are detained for not affording to clear their medical bills. I have personally rescued many women from many hospitals, and many other leaders here, the MCAs here can attest to that, the members of parliament here can attest to that, and we are calling out to the government of Kenya that this must stop.
Must stop.
The Constitution of Kenya is very clear. The right to accessing health facility and care is a right that is enshrined in the Kenyan Constitution. We have had many hospitals who do not report maternal deaths and neonatal deaths. We don't have a law to press for accountability and transparency. We therefore, as we celebrate these 16 days of activism, want to press the government of Kenya through Parliament of Kenya, where I am a member, supported by these leaders, that it is high time we came up with a law to make sure that every healthcare provider, every hospital, whether public or mission hospital or private hospital, must be accountable for every neonatal death and every maternal death.
Yes.
This morning, I received some news of a very aggressive young woman who lost her life yesterday morning in a private hospital here in Resambo. And I followed in the nearest police station to check whether that death was reported, and it was not reported this morning. How many more hospitals are killing our women? Babies are dying in those hospitals, and those cases are never reported. So it is time for us to press the hospitals for accountability and transparency. Last but not least, we have had scenarios where the government of Kenya has withdrawn Linda Mama, a facility that has been helping the vulnerable women of Kenya to access maternity health care. Now we are being told that the Linda Mama aspect has been enshrined in the new SHIF and SHA medical facility. We want to see action. We don't want to see to hear rhetorics.
Yes.
We want to hear women giving us testimonies that they went in and they came out with their babies without being detained and being followed and being auctioned their property because of medical bills. Wamama hoi.
Yes.
We want to make sure that every woman, whether disabled or able, employed or not employed, respectable or not respectable, every other woman who has the power to conceive must be given the power to deliver their baby.
Yes.
We must make sure that those women who are delivering babies are not delivering babies, but they are delivering their babies in dignity and with respect.
Yes.
Women must not be abused anymore as they push their baby out.
Yes.
Women must not be branded names because of the conditions they hold when they are delivering their babies in the hospitals.
Yes.
Women must not be allowed to deliver babies on the floor. Yet the government of Kenya is taxing us every day to provide for those facilities.
Yes.
Women must not be forced to carry basins and scissors and gloves in hospitals because they have carried babies for 9 months. That is enough pain. We don't want our women to be told to carry basins, to carry water jerrycans, to carry scissors to the hospitals because we are paying this government of Kenya taxes to take care of our women. Wamama hoi.
Oi.
We are calling upon the members of parliament to hurriedly and quickly, even before these 16 days of activism are over, to stop doing public relations and go to parliament and deliver for us the bill that is going to make sure we have registered less neonatal deaths and less maternity deaths.
Yes.
That bill is already there. It's a Senate bill. It has been amended on the 8th of October. That bill is now in the hands of the National Assembly. We are now asking members of parliament, before they go for Christmas, they must deliver for us that bill so that the mothers of Kenya can start delivering their baby with respect and dignity they deserve.
Yes.
And finally today, as the founder of this campaign, Heshimu Uzazi campaign, I am so elated and very happy to successfully launch a toll-free call number for the women of Kenya who feel violated, abused, or mistreated or disrespected in our health facilities. Those who need to be supported with legal counsel, psychological counsel, those who want to have corrective surgery, there is a number you can call so that we can connect you with the right intervention you require.
Yes.
Wamama hoe.
Hoe.
Kwa hivyo leo tumekongamana hapa tumesema heshimu
uzazi.
Heshimu
uzazi.
Heshimu
uzazi.
Na tumesema kwa Kiingereza stop obstetric violence, stop OBV, stop
OBV.
Stop
OBV.
Stop
OBV.
Asanteni sana.